This is Mindy Gaspard, and this is my public service announcement on pelvic inflammatory disease. Pelvic inflammatory disease, frequently known as PID, is caused by the upward movement of certain bacteria from the vagina and cervix towards the upper genital tract. PID is known as a polymicrobial infection because it can be caused by many different types of microorganisms. PID is a complication of an earlier sexually transmitted infection like chlamydia or gonorrhea. PID occurs more frequently in women than in men. Symptoms of PID include pain or tenderness in the lower abdominal area, mild pelvic pain, increased or abnormal green or yellow vaginal discharge with a foul odor, irregular menstrual bleeding, painful and frequent urination, painful intercourse, pelvic organ tenderness, inflammation, fever greater than 100.4 degrees, nausea and vomiting, and cervical motion tenderness. PID causes inflammation and swelling of the uterus, fallopian tube, and ovary. Severe cases of PID also cause adhesions and abscesses of those organs. Complications can include scarred fallopian tubes, tubal-ovarian abscess, tubal factor infertility, ectopic pregnancy, pelvic adhesions, chronic pelvic pain, and permanent infertility. Pelvic inflammatory disease is transmitted by the cervix being previously exposed to a sexually transmitted disease. The cervix becomes infected and less able to avoid the spread of organisms into the uterus, fallopian tubes, and ovaries. 90% of all cases of PID are caused by untreated present cases of gonorrhea or chlamydia. Unfortunately, there is no specific test for pelvic inflammatory disease, and diagnosis can be imprecise. PID is primarily diagnosed by a combination of obvious physical signs and symptoms, a pelvic exam, vaginal discharge analysis, and cervical cultures, or a simple urinalysis. Upon early detection of PID, it may be treated with a simple combination of antibiotics. Severe cases may require hospitalization. If you are being treated, it is important that you notify your partner or partners so they may be treated as well. Anyone can have this disease and not produce any symptoms. Until all treatments are complete and your follow-up tests come back cured of the infection, you must avoid sexual intercourse. Ways to prevent PID are always practice safe sex. The best form of prevention of all sexually transmitted diseases is abstaining completely. If you are sexually active, it's best to be in a monogamous relationship and both partners be tested regularly. You can also talk to your doctor about various contraception options. Some options include contraception that prevents PID, while some are known to increase your risk. And maintain clean hygiene habits. In the United States, over the past 10 years, we've seen a general decline of cases of pelvic inflammatory disease. However, from 2006 to 2010, 5% of women have reported being treated for PID in their lifetime. In 2012, Louisiana had the fourth highest cases of all 50 states of chlamydia. That same year, Louisiana had the second highest number of gonorrheal infections, with Mississippi being in first place.